Before we begin, please remember that the following information is for general purposes only and should not replace professional medical advice. If you have questions or concerns about your health, please consult your doctor or a qualified healthcare professional. Okay, so imagine standing on the front lines of a pandemic, day after day. You're a medical worker, already handling life or death decisions, now facing a crisis that has shaken our world. For many of Japan's doctors, nurses, pharmacists, and other healthcare professionals, the COVID-19 era has turned their calling into an emotional battlefield. Recently, researchers set out to understand how this crisis was truly affecting our healthcare heroes. Actually, they surveyed 142 medical workers and compared their responses to those of 138 individuals from the general population. The results painted a stark picture. Medical workers reported higher levels of anxiety and depression, felt more isolated, and struggled with less hope and lower self-compassion. Why is this so alarming? Because when medical workers suffer, the entire healthcare system suffers too. Burnout and mental strain don't just impact the providers, they trickle down to their patients. One key discovery was that loneliness stood out as the strongest indicator of mental health struggles among medical workers. Long, draining shifts in full protective gear, separation from family for fear of spreading infection, and the weight of constant vigilance. It's not hard to see how many felt alone, even when surrounded by others. But there was hope, literally. Hope and self-compassion played protective roles. Holding on to the belief that a better tomorrow is possible helped lift spirits, and being kind to themselves in moments of struggle, rather than self-critical, offered a buffer against stress. These two factors served like guiding lights in a dark corridor. So, what can be done? The study suggests addressing loneliness at the workplace level. This might include regular team check-ins, peer support groups, or one-on-one counseling sessions. Building a more connected, understanding environment can go a long way toward reducing stress. Emphasizing hope and self-compassion through mindfulness, shared encouragement, or professional mental health resources can further protect against burnout. These findings aren't just numbers. They're a call to action for hospitals, clinics, and policymakers to step in and support the people who care for us every day. Even in the midst of a pandemic, hope and self-compassion can be the antidote to isolation and despair. For Japan's medical professionals, this light begins with feeling less alone and remembering to extend the same kindness to themselves that they show to their patients. This video is based on the research article titled Mental Health of Medical Workers in Japan During COVID-19: Relationships with Loneliness, Hope, and Self-Compassion, authored by Yasuhiro Kotera and co.